Good afternoon. Thank you for tuning in today. My name is Jeff McKay, and with me is Mark Ayre. Hi, Mark. Are you there?
Hi, good afternoon, Jeff. How are you today?
I'm doing great, Mark. Thanks for asking. Today, we're going to talk about a new feature that was launched this summer, all about multi-organization management and membership. So we'll do a demonstration of that. But first, here's Mark and I in all our suited glory. Those are not Brightsquid uniforms as much as it looks like they are. So what we're going to talk about today is who is multi-org management for. So there's a number of different types of organizations that can get a lot of use out of multi-org management, multi-org membership. And we'll talk about how it applies to those different types of organizations. We're going to talk about what it is, what it lets you do. And Mark's going to take us through a demonstration of how to get it set up. And it's quite easy to set up. It was a lot of work on our end to get it so easy to set up. And then just show how people can move between different orgs. And we'll talk about through that what we mean by organizations or orgs. And then we're just going to talk about sort of what the benefit of this across the system, what we're aiming to do, and what you can expect when you're working with Brightsquid SecureMail in this capacity. And then, of course, the very exciting part at the end when we get to pick winners of the draw. Well, it's not actually a draw. One winner will be drawn, and two other people will be rewarded for being the top users of SecureMail on the call in terms of messages sent and invites that go out. So healthcare organizations, what are we talking about? So when we talk about multiple organization management, now this organization term can be used in a number of ways. We can talk about clinics. So if you're with a group of clinics, let's say you have 3 or 5 or 18 or 70 medical clinics under your control or administration, this applies for you. If you have multiple physician clinics, we'll talk about how this helps you organize messages by clinician. If you want to run your practice that way, so if you have 5 doctors at your practice and you want to set up an inbox for each one of them and have staff that work for all of the physicians understand where those messages are and be able to move back and forth between working for those physicians or answering messages for those physicians. So long-term care facilities, home care facilities, anybody with multiple teams or people that might work at different facilities on different days. Maybe they're in Edmonton one day and in Leduc the next, things like that. Primary care networks. So if you have a large sort of overarching organization administering aspects of the clinic or funding different subscriptions and interested in looking at who's using it, this works there as well. Regional health authorities, obviously, if you have multiple locations or teams that want to be administered from a single location, this works. Same thing with health teams. So if you look at Ontario, for example, health teams that are multidisciplinary, that might have people across a region geographically that are using SecureMail, and you want to administer them from one place, and maybe there's just different teams in different places that have SecureMail locally, but you want to do it from one place. So that's really what we mean when we talk about orgs. It's kind of everybody, and it depends on how you want it to be set up at each one of those organizations. So what multi-organization management lets you do is you can manage multiple clinics or teams from a central location, as I've said. What that means is you can edit member details and edit the clinic details. So clinic details are the name of the clinic, how you want that to appear. So maybe it's teams within a clinic. So we have clinics that have teams, and the teams are identified by a color. So you want to have a shared inbox for yellow team or a blue team or red team, and that's all managed by one administrator. So we can change the name, we can change who belongs to those organizations. So you can invite or set up new user accounts. You can also remove user accounts if somebody moves on from the team. And you can edit their details. So you can, Mark will take us through this, but their name, their salutation, all that kind of stuff, you can set up from one central place. Now, what does that look like? Here's a pretty simple diagram. So you've got your healthcare organization, be it the greater clinic or the organization is administering multiple clinics. So for example, a dental support organization that administers several hundred clinics may want to administer all of the secure mail accounts for each location from a centralized place. And now one person in this Healthcare Oregon MINS box, and it can be more than one person that has this authority, can manage the secure mail accounts for each one of the suborgs within that organization, be they teams or be they different organizations, or, like I said, specifically if you want to manage an inbox for each clinician at the practice. So multi-org membership is a really interesting feature that relates to a lot of the ways that many clinics operate. So, especially in dentistry, some medical groups, if you have multiple clinics, staff might move between locations. And if you have one large clinic that has 5 or 10 clinicians, staff are likely going to work for each one of those clinicians, maybe at different times. And so multi-org membership allows you to better organize. So in the past, what you would have had to do, if you have a clinic with 5 clinicians, you have one clinic inbox. Now you can have a clinic inbox for each clinician. So a shared inbox that you give staff access to, and now the staff have access to 5 different inboxes. Now, not all at once. They're selecting as they go into their secure mail account which box they're going to log in now, because they have rights to all 5 or 3. And they're going to be working specifically in one inbox, addressing patients that have sent messages to their doctor's inbox rather than the clinic. So from a patient perspective, it's easier to organize. And from a clinic perspective, it's easier to organize as well. So we can switch between different teams within the organization, or if on Tuesday, like I said, I work in Edmonton office, and on Wednesday I'm in Leduc, I can log into the proper location when I arrive in the morning and I want to address patient messages there. So it really helps users organize tasks and messaging around either jobs or, like I said, clinicians. So you can give people the ability, without creating multiple personal accounts, which would require additional email addresses, or sharing login, which we really want to avoid. It's not a compliant way to use any system if people are sharing login information. So this helps you organize your staff or your clinics in a way that's compliant, because we can identify who's seen that information, and it's not just people logging in with Dr. Jane at Gmail with the password that everybody shares. We don't want to do that. So just a quick illustration what that looks like. Someone who was originally at suborg 1 can be at suborg 2, and vice versa. We switch them around. People can kind of shift, and that can happen throughout the day. So if the staff is sitting at the front desk and they need to address messages for a different clinician that came in, they can log in differently and switch the account that they're working in right now. So with that background, I'm going to hand things over to Mark so he can take us over. I will point out, as questions occur to you throughout the presentations, Mark's going through the demonstration or anything I've talked about, there's a question box you can type into in the GoToWebinar control panel on the right of your screen. So put any questions there. We'll get to any ones that we have before the end of the presentation as much as we can.
All right. Thanks very much, Jeff. So as Jeff was saying, the opportunity to now use a single login to access multiple organizations or clinics or practices, whatever you call your various constructs within Secure Mail, makes it possible for a user to move from one location to another and carry out some of those tasks that Jeff had talked about. Now, from a actual visual standpoint, let me explain and illustrate a couple of these things. I'm logged in right now. If you're seeing my screen, it looks like you should all be able to. You can see here that there's a new vision that visual element you may not have seen before, which is up here in the top right-hand corner where we used to only have the logout button. There's now a little drop down that actually shows all the different clinics that I belong to. Now, the person I'm logged in as here, this MOA named Clara, belongs to 2 different clinics. One is called Fauchard Clinic Southland and Fauchard Clinic West Hills, so South or West for short. And as a user in those two practices, this is how I would toggle from location to location. So if I now needed to go do some work and access the shared inbox from the west location, I would just select that option here. My screen quickly reloads, and now I'm in the shared inbox for the west location of the Fauchard Clinic, as opposed to the south location where it was a moment ago. So that's what it looks like when you have access to multiple clinics. Now, for the sake of brevity, I'm only showing a user that has access to 2 different clinics, but you're not limited to only 2. You can belong to a dozen if you need to, or more, as Jeff mentioned. But I'm going to switch my point of view back to the South Clinic. And let's take a look here at how we actually set this up. So I'm going to go to the settings option, which you should already all be familiar with. And of course, within the settings option, I would go to clinic members. And using the same functionality that you've used before to add new members to your clinic, which is the add new user option up here, the only difference is now when you add a new user, you have the opportunity to add a user that's already a Brightsquid registered account holder. So it used to be if you selected add new user and you entered an email address of someone who was registered at another clinic, you'd get an error saying you can't invite this person because they work somewhere else, or words to that effect. But now, if I enter the email address of one of my made up test users, as soon as I enter his email address, I'll get this little notification, a little green pop-up toast, as we call them, in the bottom right-hand corner that says Jimmy Olson already exists in the system. His details are automatically populated, just fill in the rest of the information. So as soon as I verified his email address, you can see that his name, first name and last name appeared there. And now all I need to do is assign him a role within the Fauchard Clinic of Southland. Now, one other minor visual change you'll notice is that now the clinic member details are separated into 2 sections. There's general information about the person, which is of course their email address, their first name, last name, salutation, doctor, Mr., Mrs., what have you. But then they also have individual settings within a specific clinic. So what I mean by that is, for example, Jimmy may have the role of clinician in one clinic, but staff in the other. That's probably sort of a rare situation, but a much more common situation is whether or not the user has access to administrative tools and or whether they have access to the shared inbox in the different locations. So that gives the opportunity for someone to, be an administrator in one clinic but not another, um, have access to the shared inbox in one location but not another. And as a staff member, I may be an MOA in one clinic and reception in the other, or referrals clerk in another, for example. A couple different ways that you can configure that information. But now, once I've added Jimmy to my clinic, as always, he appears immediately in this list of users that are in my clinic, and the various tools that we've assigned to him are there. But you'll notice the little orange triangle next to his name indicating that he's still pending. So what that means, of course, as always, is that he's been invited, but hasn't yet accepted the invitation. The difference is when Jimmy gets notified of this event, he won't have to re-register. He's just going to be prompted to accept the invitation to join the second clinic, which you'll see when he logs in. So an email's been sent to Jimmy, and when he logs into his account, he'll just confirm, yes, I need to belong to the Southland Clinic, as well as whatever clinic he's already a member of. Now, one quick note is right now, because Jimmy is pending joining my clinic, some of the information about him won't be editable. However, once he does confirm his membership and joins the clinic completely, then all that other information can be updated and changed if need be. So again, once a user has access to a second clinic, or at least 2 clinics, that's when this little visual element of the clinic selector option will appear. And as you move from clinic to clinic, of course, you will inherit the specific privileges and tools that are assigned to you within that clinic. And in order to join a second clinic, you must be invited by a current administrator of that clinic. So that's really all there is to it. Like I mentioned, not a lot of new visual elements, But I think that the general concept of being able to be a member of different clinics opens up a lot of different opportunities. The primary one that Jeff talked about a moment ago is that now your clinic can have sort of different groupings for each of your physicians if need be. So essentially allowing you to create a shared inbox for each of your physicians and then assign staff to monitor those shared inbox as required. Anyhow, that's all I have for you today. I'm going to turn the conversation back over to Jeff, and we'll wrap up with a couple of questions and some of the other things that he mentioned. Jeff, are you still there?
Yeah, thanks, Mark. I am gonna grab control back here, and we'll move on from the demonstration. So we just want to talk about, how does this fit into the healthcare ecosystem? So you think about it now, as more and more clinics come on board SecureMail, and there's 700-800 more clinics every month that join the system. Now we're looking at an expanded capacity to stretch across the health ecosystem with a standardized secure messaging. What ends up happening is, there's a thing in patient life called portal fatigue. So if you work with 2, 3, 5, 8, in the case of diabetics, for example, we know the standard course of care involves 12 different clinicians in the run of a year. So if every one of those clinics operates their own secure messaging-ish portal or some version of communication online, that's a lot of work for patients to keep track of, and it actually ends up making patient life more complicated. So what you're doing by getting involved with SecureMail, expanding it across the organization, structuring it properly with shared inbox, setting up your virtual front desk in that way, using multi-org management and multi-org membership to really build out your clinic's capacity for organizing your messages. You're making it easier for patients and in turn the system to provide better care to those patients by improving access and communication across the board. So now we've got a healthcare ecosystem that's expanding in terms of the connections that you have available to you. So, I recommend looking into the directory for clinics that you work with regularly. Do a quick search anytime you have to send out a referral or a consult note. Check and make sure they're there. And if they're not, invite them through to SecureMail, because with your SecureMail account, you can invite any other practice to join SecureMail, including clinics that might be in your group. So that kind of brings us to the end of our presentation. So we're done early today, which is great, but we do have a couple questions. So Mark, let's go back to you. So we talked about grouping orgs and that kind of stuff. How do we create new orgs, and what does that structure look like in terms of building out this multi-org?
Oh yeah, it's a great question. I probably should have addressed this when I was screen sharing a few moments ago, Jeff. So if you already have one org, let's say you have one organization or one clinic that we'll just call family medical, and you need to create a second location, maybe family medical location B or north or what have you, just contact our support department. And of course, we all know how to do that. It's through the little question mark icon on your screen. You can call, email, or live chat with our support department, and they can create an additional location for you, make the existing administrator of location A also the administrator of location B, and then that administrator can invite the team to join. So the short version is contact support will create the additional new location for you, and then you can populate that new location with the appropriate team members.
And now, to that end, Mark, to get started with a new location, what sort of information do we need? We need an email address. Is there anything else?
The practice name, the physical address is actually important because that goes into the directory, and it's so important that information be accurate and complete, because when patients are looking for you in the Brightsquid directory, I think a lot of users kind of forget this, is that there's nearly 180,000 different clinics in the Brightsquid secure mail system. And I can tell you from my own experience, a lot of them have the same name. Last time I looked, I think there was approximately 120 Family Smile Dentals in the system. So what I'm driving at is that when a patient is looking for your clinic and they search our directory for family dental and they see 120 results, they're looking for the address and the phone number of that clinic to make sure they've got the right one. But also the members of that clinic need to match their expectation. So if they find a family dental and the dentist that they work with regularly is listed as a member of that clinic, they know they've got the right clinic. So that's why we would need to create a new clinic to answer your question. We need of course, the name of the clinic, the address, the phone number, and then as the administrator, you need to populate that clinic with the appropriate team members so that patients know they've got the right place when they are sending their private health information through SecureMail.
Yeah, no, exactly right. And I will point out too, even just beyond that, like I said earlier, making sure that all of your team has their account set up or has an account set up. There's a number of other benefits beyond just compliance. You need to make sure that we can show who it was that was looking at that information, and a member of the front desk doesn't cut it. But also in terms of training, so we will be launching SecureMail training through the SecureMail portal, so you can make sure that you can direct new staff or existing staff, hey, we'd like you to go take the SecureMail training because it helps you understand how to structure SecureMail, but also different ways that it can be used. So clinics, if you haven't taken your training yet, clinics that have taken it do actually typically use SecureMail a lot more because staff understand what it's for, how it's used, and they see different use cases that they can apply to their day-to-day. They also recognize that SecureMail is a very valuable tool for virtual care. And as we move forward through COVID-19 and beyond, there's lots of stuff. You can see this week, the Chief Medical Officer of Canada recommends continuing to use virtual care with clinics. And that was a notice and press release that was sent out directed towards patients saying, hey, you should be looking for these options with your clinics because it's going to help us be healthier and better from a healthcare system standpoint. So you want to make sure that you're on board that train. Getting staff trained and having them have their own account helps facilitate that and support the fact that you'll be ready when patients come looking for that service if they're not already. So the other question that we have today is, what is the cost of adding more organizations?
So there's no additional cost generally for adding another clinic. The billing unit for Brightsquid SecureMail is always based on physicians. However, so I guess to follow the logical progression of that is if we add a new physician account or a new physician user within a new clinic, that would also be another billable unit. So that typical list price for a SecureMail subscription is $39.99 per month per clinician. So yes, potentially if we add a second location and that clinician exists in both locations, there would be two bills for that. However, if it's just a new location that we're just sort of spreading out clinicians from one central location to multiple satellite locations, there'd be no change in your bill.
Well, as I understand, anytime you order it, you're essentially getting a new account, right? So it would be $39.99 for each new location that you wanted to add, like for a different shared inbox. Is that correct?
Well, yes. If we're adding a new clinician in a new location, then yes. But if you currently have, for example, 3 clinicians in one location, and then we convert that to 3 clinicians in 3 locations, it's the same price. That doesn't change.
Yes, right, absolutely. Yeah, so I guess it kind of depends on how you're looking to get set up and how you're set up currently. So that brings us to the end of our presentation today. We got out a bit early. If you do have any further questions and want to set up different orders, or you want to split out your clinicians into having their own inbox, reach out to Mark and his team through the support link in your SecureMail account, absolutely, or just visit us at support.brightsquid.com, and we will be more than happy to get you set up with multi-org management and membership. Winners of the draw today. So for most secure messages sent, we have Cindy I. So congratulations on that, Cindy, consistently coming into these webinars with most messages sent. I think your clinic is very, very on board with SecureMail and very driven to make that change. Most SecureMail invites goes to Allison. Congratulations. Great job expanding the network and getting more use out of your account. And for winner number 3, participation. So for showing up today, we have Terry. Terry, thanks for tuning in. And to everyone else, have a great rest of your day.